Right, well, over to you. I mean, the speech is there, so...
Minister, could you give a brief overview of your plan for First Nations Health in Queensland?
Yeah, so, well, we've obviously got the refresh of the First Nation. We've got the First Nations Health Strategy. We've got the refresh on it. The practical delivery of better health outcomes is really what we're keen to talk about. We know that we've got more work to do. We've got the Part A and Part B responses to the inquiry up on Torres and Cape. Part A has been released. There are 12 actions there. 7 of those are nearing completion. 5 we hope to have completed by the end of the year. And the HHS is working very closely on that. You've heard obviously of my travels up to Mornington, up to Doomadgee, and more work there. What we want to see there is increased activity in terms of particularly around the workforce, because we know that culturally appropriate care delivered in those communities works best, and that care is best delivered by local people working in our health workforce. And so our plans in relation to that are also part of it, and we're working on our health workforce strategy, which will be done by the end of this year. We'll have a health workforce strategy.
What is the consultation that you've undertaken with First Nations during this period at this stage?
No, just...
Can we repeat that?
Yes, that's right. So in terms of consultation, we've obviously got ongoing work with Quake, and we're continuing to liaise with them. Haylene Grogan, our First Nations Health Officer, is obviously in regular contact around there. On top of that, I think most importantly for me has been getting my feet dusty on the ground in those communities. So at Hopevale, catching up with Mayor Bruce Gibson up there, and their willingness to engage with Queensland Health about new models of healthcare. It is about travelling to Mornington Island and listening to what they need in those places. That really informs me when I go back to the department and sit in 1 William Street about what is working on the ground. So there's a lot of work. There's no one plan, as I'm learning, that is suitable for all of our First Nations community. They're all discrete. They all have particular issues, and picking up on those is really important for us and feeding that into that workforce plan.
Earlier this year, there were some mooted changes to the to mainstream Indigenous healthcare and to the First Nations Health Office and Haylene Grogan's role. Are those going ahead? Is there anything going to change there? What can you run us through what is
Yeah, sure. So what occurred there is the Director General wanted to realign, if you like, the many divisions in Queensland Health. As you can imagine, it's the biggest department.
Yes.
And so there was a realignment of those divisions. Haylene Grogan, the First Nations Health Officer, was made a permanent member of the executive leadership team. Previously, she'd been an invited member. She's now a permanent member, and we have streamlined the workforce delivery program so that the Chief First Nations Workforce Officer is now sitting with the Queensland Health Workforce Planning Division, so that we have greater, I guess, a greater vision and a greater view over the needs of our First Nations workforce together with our existing workforce plan. So there's greater opportunities to leverage off those two areas rather than having them sit in separate silos to drive that growth. I know there were questions in Parliament asked about that. That plan has received overwhelming endorsement and is now in place and working.
And there won't be any further changes at SIT?
These are matters for the Director General. He runs the department,
sure.
But I understand, having just made these changes, there are no plans for further changes in relation to those areas. We want to bed down the changes that we've made, and those changes are, as I say, have only just been finalised. So we'll work our way through those, but it is about making sure that we are delivering the services that the 21st century is going to demand.
So really, Haylene's role has been upgraded, in fact?
Very much so, yeah. She's now been made a permanent member of the executive leadership team. I meet every week I'm in Brisbane, I meet with the executive leadership team. Every week that I have been meeting the executive leadership team, Haylene has been there or been invited and can't attend because she's out doing something else. Yeah.
Minister, many health and medical groups are very worried about the impact of your government's justice laws on Indigenous health and wellbeing. Is that a big issue for you as the Health Minister?
Look, I think the most important thing for me as Health Minister is staying focused on what I mentioned in my speech, and that is my charter letter, and that is working with my colleagues across government to deliver better health outcomes. Now, I can't speak for every other minister, and it would be improper and inappropriate for me to do so. I can make a difference in my portfolio, And I've really taken it on myself to make sure that I am travelling, that I am listening to our local community-controlled health organisations, that we are listening to them. One of the first steps I took was the renaming of the Doomadgee Hospital. Something that, as I said in my speech, is so seemingly simple, but has changed the whole dynamic. People are now prepared to go to the hospital. So it's no good having the best facilities and well-trained staff if people are not prepared to attend. And we've removed the bars, and people were triaged in cages, and that's just not acceptable. And why are we doing that in our own population with our own people? So we want to get people in. And we know that there are significant problems with youth justice. And we know we need to address the youth justice problem. So not only, and I think people do focus on the adult crime, adult time laws, which we put in place to protect the community, but also the early intervention programs and the money and the funds that is going into that. And quite a substantial amount of money is going into those programs. I think strengthening communities, well, is the best thing we can do to alleviate some of those both crime and health problems, and that's what I'm focused on.
You would have heard here today, though, that the big concern about suicide rates particularly,
Yes.
we all know the connection with over-incarceration around that. Are you worried, though, that in these early stages, actually what's going to happen is that closing the gap targets will worsen because of your policies?
Yeah, look, back in February, we were up in Cairns, and we had the Premier called a meeting of all the regional Aboriginal and Torres Strait Islander community mayors with ministers. We had, I think, 37 mayors in the room with us. And I remember what Mayor Alf Lacey said, and it's very clear. He said closing the gap is failing us, and has been failing us, not just for this government, but for communities across regional Queensland and remote Queensland in Aboriginal and Islander communities. We are going to more funerals for our young men than we are going to 21st birthday parties. And that is the case. And we're seeing that in the numbers. And I got that up in Mornington Island. I spoke about Auntie Louisa, and her cry from the heart was, what are we doing about our young men? So the solution, as I said, is not just in the legal sphere and not just in the youth justice sphere. It's not just in the health sphere. It's in the strengthening community sphere. We don't want to see young kids from community going into youth detention centres. And yes, they're overrepresented. We want to see less of that. But we have an obligation to protect communities as well. And so we're balancing those up, both with protecting community, while also investing in early intervention, while also doing what we can in health, and that is by addressing some of the needs of communities by providing better mental health services, better ATOD services, more culturally aligned care, and working with our local communities. And on Palm, where the Mayor and the previous Mayor have got together, they have put in place a number of things, that initiatives led by community elders, that are reducing the crime rate there quite substantially.
Why is the gap not closing? In fact, in some areas it's widening. Where are those failings, and with all the data and knowledge and funds that we have available, why is it still continuing to...
Yeah, I think I addressed some of these issues in my presentation, and I think some of it is that the money is not going where it needs to go. It's often the case that it's not the money that is the issue, it's the direction and where it's being used. If there's an example, and it came out of the blue to me, is the federal government has agreed to fund renal dialysis chairs on Bargo. But that's not where they're needed. Money would be better spent investing in dialysis chairs on Torres. And that money is going to the wrong place. And the local community weren't consulted about that. And so now we have that disconnect, which is what I spoke about in the room there, and that is, with the best intentions and the best will, there's not the necessary connection between what the Commonwealth are funding, what community tells us they want to have happen, and what the people who deliver the service on the ground need to happen. We deliver the service. The Commonwealth don't. We provide the nurses. The Commonwealth don't. We employ the staff. The Commonwealth don't. You think it might make sense for them to have a chat with us about where they're investing their money, because we are talking to the local communities about what they need and where they think they need it.
So will you be able to achieve these goals then with those hurdles in place? How will you?
Look, I think if we don't have goals, we'll never achieve them, and we are seeing some improvements in some of those areas. I wasn't here for the earlier part of the session, as you appreciate. I know on some of the metrics, Queensland Health is doing quite well, but on some we're not doing so well. Suicide is one. I think average birth weight is another one that we've got to do some more work on as well. So there are some gaps that need to be worked harder on, and we'll continue to deliver on that. We'll continue to work on delivering those, I should say.
Minister, the Western Australian Government last week finally announced a redress program for stolen generations.
Yes.
That leaves Queensland as the only state or territory not to do so.
Yes.
30 years on from that recommendation,
Yes.
what have you got planned?
Well, that I think is, again, if I can say, that's something that for the appropriate Minister Simpson to respond to. That's her portfolio area. I think, from my perspective, what I am talking about is driving practical, better health outcomes on the ground. That is a matter for Minister Simpson to address those issues. And my focus is quite clearly on the future and what we can deliver in the 21st century to address the healthcare needs of First Nations people, whether they're here in the southeast, which is where by far the biggest population is, or whether in remote communities where by far it's most difficult to access those health services.
Redress screens do have positive health benefits, like the Royal Commission into Child Sexual Abuse has led to a redress screen, which led to positive health outcomes in people.
Yeah.
Is it not part of the solution there?
Well, as I say, if we are investing enormous amounts of money. I think our investment in some programs, for example, exceeds $100 million across the state into specific programs to First Nations people. So system-wide, we are putting the money into those programs, and we are making those investments, whether that is clean water and clean drinking programs, whether it's our public health programs around mentoring and education around cleanliness in homes, or whether it's actually delivering better housing in our remote and regional communities for our First Nations people. We are investing the money in it. Those are where the big changes are likely to be made, and where the big advances are likely to be made, and that's why we continue to look at making sure we invest in those areas.
Might have to wrap up one more question.
Why do you think on youth suicide among Indigenous people, which is unbelievably high and continues to be high, it's not your fault, it's many decades in the past.
Yeah.
Why do you think that is the case? What is the problem?
Look, I think if I had the answer to that question, I wouldn't be standing here in front of you now. The issue is complicated. There's no doubt, and it's grown up over, as you say, over years. I don't want to be that person who believes they have the solution for it. I think though, I do want to be the person who works with local communities to drive a solution for that problem. And that's really what my commitment is, and that is to work with local communities to make sure that we can drive that solution. Some of it is owned by the communities themselves, and they are great at acknowledging that. I don't get any sense that there's a walking away from their own responsibility. And a number of conversations I've had, people have said to me, we need to take responsibility for our health outcomes. We don't want you just to keep supplying dialysis chairs. We need to take control so that we don't need those dialysis chairs. We need to help people take control.